start a little bit with just to acknowledging how difficult this pandemic has been. I mean, so far this disease has sickened over 58 million people across the globe, and nearly 1.4 million people have died. Over 250,000 people in the United States have died so far, and that's in less than a year. One of the things that is particularly frustrating to me that I hear periodically are folks who say that, oh, it's just like the flu, it's no worse than the flu. But in 10 months, this disease has killed 5 times the number of people who in a typical full year would die from the flu. In less than 10 months, that 250,000 number is more people than are killed by strokes, suicides, and car crashes in a full year combined. It's 10 times the number of people who've died in car crashes. And the leading cause of death in the United States is heart disease, and we probably won't exceed the total number of deaths from heart disease due to COVID in a year's period. But we anticipate that we will by January exceed the number of daily deaths from heart disease due to this disease. Because we are in and continue in a real acceleration phase for this pandemic. More than 1 million people more than 1 million cases were reported in just the past week alone in the United States over the past 7 days. And over the past 7 days in Alaska, 4,000 cases were reported. And that's understanding that the state health department is a little bit short-staffed to fully keep up with validating and verifying every case and getting them entered in their data system. And those 4,000 cases, just by comparison, just 1 month ago, the week's total report was about 1,700 new cases. And so every week it's just, we've watched it climb. And I know this pandemic has been disrupting our lives in so many ways, our economy, our children's education, our relationships. I know everybody's really tired of it and probably tired of hearing about it too, but I think I really appreciate the Healing and Wholeness Committee wanting to have this forum and to allow us to have this conversation and to help folks understand more about it, and really to understand that there really are just a few simple things that if we all did, if all of our friends and neighbors and family would do, that we really could turn the curve and start heading in the other direction. There is light at the end of the tunnel. We have vaccines that are coming, hopefully pretty soon, but I'm afraid it's going to be a while still before those will be available, especially to the general public. And so I think we have some pretty dark days ahead. And so I wanted to, with those very somber thoughts to start us off this morning, I thought I would start with a prayer. And when we're done, I have just a short kind of devotion I thought I would share as well to wrap up. So this prayer is a prayer for during a pandemic, and it's by the Sisters of the Immaculate Heart of Mary in Pennsylvania. Let us pray. Loving God, Holy One, your desire is for our wholeness and well-being. We hold in tenderness and prayer the collective suffering of our world at this time. We grieve precious lives lost and vulnerable lives threatened. We ache for ourselves and our neighbors, standing before an uncertain future. We pray, may love, not fear, go viral. Inspire our leaders to discern and choose wisely, aligned with the common good. Help us to practice social distancing and reveal to us new and creative ways to come together in spirit and in solidarity. Call us to profound trust in your faithful presence, you, the God who does not abandon, you, the Holy One, breathing within us, breathing among us, breathing around us, in our beautiful yet wounded world. Amen. I'm going to start off with covering just some real basics, some background about what COVID-19 is and how it spreads, and just a quick overview of some of the symptoms. And then talk a little bit, answer a few questions about how to protect yourself and your family. Then Regina and I are going to take turns answering a series of questions about what to do if you're sick or exposed. I'm going to cover some hospital-related issues, and then Regina is going to talk a little bit about some community issues, like issues related to schools and schools opening or not, and contact tracing. And then Dr. Mandsager is going to wrap up with answering some questions about some of a couple more kind of clinically oriented issues. So just starting off, what is COVID-19? COVID is short for, the word COVID is short for coronavirus disease, and the number 19, it comes from the year 2019, which was the year it was first discovered. And it's a disease caused by the SARS-CoV-2 virus, which is a respiratory virus in the family of coronaviruses, coronaviruses are spherical particles that have little spikes sticking out of them. And apparently and we've all seen pictures and animations of them, I'm sure, but under an electron microscope, they look like a crown, and corona means crown in Latin. When those virus particles enter our bodies, typically through our nasal passages, most commonly, those spikes attach to host cells, usually in our respiratory system, and will break into those cells. And a virus isn't actually living like a bacteria. It can't replicate on its own. It has to kind of hijack a cell in our body, break in, and it starts reproducing itself after it's injected its genetic material into another cell, and eventually kill that cell, burst out, and then go and infect a whole bunch of other cells. And that's how it spreads throughout our body. There are a number of varieties of coronavirus that have been circulating in our population for a long time. Many of those, or at least a number of those, can cause the common cold, or some of the viruses that cause the common cold. I think what's different about this coronavirus is it's never been experienced in the human population before. You might have heard of it referred to as a novel virus. It's because it's new to the human population. And so our bodies don't have any sort of immunity built up to it to be able to respond and fight it off. And one of the features of this virus that I thought was really interesting when I heard it, it helped me really to be able to visualize why washing your hands is so important. But the shell of the virus, or the membrane around that little sphere, is actually made up of a lipid or a fat. And so under heat and soap, it melts, and destroys the integrity of the virus particle. So it spreads through person-to-person contact. It mainly spreads through droplets. The particle is transmitted through droplets that come out of an infected person's nose and mouth. What really got my attention about this, I assume we all have seen like the animations of people sneezing and seeing all the particles illuminated flying out. I don't know I assume most people have. I had seen those for years. But at one point this summer, I was just sitting in my house talking to my family members, and the sun was shining. It was shining through a window. And I don't think I had ever noticed this before, just talking, and I'm sure I'm doing it right now. I am spraying spit all over my computer screen right now. And I know that's disgusting to hear, but I had never noticed, just from talking, when it was illuminated through the ray of sun, I could just see it flying out from my mouth. And if I had been infected at that moment, that spray would have been filled with virus particles that anyone, if I wasn't wearing a mask and the folks around me were within 6 feet, could have easily breathed in those particles and been infected. And so that's how it spreads, and spreads so easily right now. You can get infected by touching a surface that has those particles on it. It's not as common to get infected that way, but it still is important to understand that and to be keeping especially frequently touched surfaces and items disinfected as much as possible. Also, an important point about how it spreads is that studies have shown that an infected person is most likely to infect other people 2 days before their symptoms start, if they have symptoms. So when they're pre-symptomatic, typically up until about 5 days after their symptoms have started. And so through that 7-day window. But one of the other real challenges of this virus and this disease is that some people have the disease or infected and remain asymptomatic, which means they never develop symptoms. And I don't know that we fully, if not even partially, understand why that is at this point. What are the symptoms of COVID? The most common symptoms include fever and a cough, nasal congestion. There also is a more unusual symptom that many people who are infected report, and that is loss of taste and smell. It also can include abdominal pain and diarrhea. But as I mentioned, some people don't develop any of those symptoms at all. And it seems like everybody responds just a little bit differently. It typically takes about 10 days after someone becomes infected to develop symptoms, 2 to 10 days, but it can take as long as 14 days. And that's why the length of quarantine that you hear about is 14 days. People are asked to quarantine for 14 days after being exposed or after traveling, and that's why. So next, I have a series of questions about how to protect yourself and your family. And so the first question in this group of questions is, what are the most important things we can do to protect ourselves and prevent the spread of the disease? And there really are just those 3 simple things that we've been hearing about. And I call them hands, faces, and spaces. If everybody washed their hands frequently, and you should wash your hands ideally with hot water and soap for at least 20 seconds. Or use a hand sanitizer that has at least 60% alcohol. That would go a long way for protecting yourself. And then faces, wearing a mask. And my next question will be about what are some of the features about masks that we should know about and how to handle them. So I'll cover that in a second. But wearing a mask on your face, covering your nose and your mouth, and then spaces, socially distanced, maintaining a distance of at least 6 feet away from people who aren't members of your household, whether you're wearing a mask or not, whether they're wearing a mask or not. If everyone practiced just these 3 simple behaviors, I think this pandemic we would stop it in its tracks. Other things that you can do to prevent getting sick and protecting others is just to avoid touching your face, your eyes, and your nose and your mouth as much as possible, since it's impossible to be washing your hands and sanitizing them continually. And as I mentioned earlier, cleaning and disinfecting those surfaces that are common touch points. And any common household disinfectant should work for that. I don't think you don't necessarily need anything special for that. Other things you should be doing too include monitoring your own symptoms, considering those lists of symptoms, just kind of keeping track of how you're feeling each day. And if you do feel sick or have any of those symptoms, do your best to avoid other people in your household and to stay home. And don't go out while you're experiencing any symptoms. Also, especially I think for Alaskans, but for everybody heading into the fall and winter, another Another thing you can do is to avoid the 3 C's. And the 3 C's are contact with infected people, closed or poorly ventilated spaces, and crowded places. And studies and experience so far have shown that the virus spreads most efficiently in those enclosed, poorly ventilated, crowded places. I'm assuming you've heard stories of the super spreader events, parties, weddings, funerals, choir practices in early days of where large group of people being in a room together resulted in just 1 or 2 people infecting a whole bunch of people. And it's called the super spreader event. I think CDC considers those events super spreaders if 1 person infects 8 or more other people in a single setting like that. And those really are the events that have accelerated this spread of this and growth of this pandemic. And finally, one thing I wanted to mention is to get a flu shot if you haven't received one already. We know that the flu vaccine really does help in reducing the risk of getting the flu. And if you do still get the flu, in reducing the level of illness and reducing the number of hospitalizations. And one of the things we'll talk about in a little bit is the strain this pandemic is putting on our healthcare resources and hospital. And so we are trying to, as much as possible, reserve those for folks who are getting sick with COVID. So the next question is about masks. What are the right types of masks to wear? What are proper ways to wear and handle and clean masks? It's important to remember that you could have COVID and not know it. And that's why we ask everybody to wear a mask when they're around other people. It really is meant to protect other people in case you're infected. And but it also, as I mentioned earlier, important to still social distance, even when you're wearing a mask, to try to stay 6 feet back from any other person you might be in a room with. It's important to choose a mask that has at least 2 layers of material, and to wear it over both your nose and your mouth, and to secure it under your chin, and make sure there are no gaps. Sometimes, especially on the corners, there can be gaps if it doesn't fit you properly. It's also important not to wear those masks that have those little valves in them. It might be easier to breathe with those in, I assume, but it doesn't protect other people from this. That actually releases your exhalations out of the mask, and so that's not helpful to wear one of those. It allows the virus particles to escape. And also, don't use masks that are difficult, that aren't breathable, that aren't difficult to breathe through. That should go without saying, but it'll be a lot easier for you to keep it on and maintain wearing it if you can find some masks with breathable material that are easy to wear. You should wash your hands before you put your mask on whenever possible, and do your best to not touch it while you're wearing it. And when you go to take it off by the ear loops. Ideally fold it in half. If it's a washable mask, you can wash it in your laundry with the rest of your clothes, but it's important to dry it in the dryer and make sure it's completely dry before you use it. And the next question I have to answer, and the last one for me for now, is about Thanksgiving coming up this week. I know everyone's already talking about what we should be doing for the holidays. I know quite a few people had trips planned to visit family, and many of those folks have canceled their trips. Because travel really can increase your risk of getting the disease and of spreading the disease. So ideally, You won't be gathering with friends and family outside of your household today to the greatest extent possible, and trying to hold your celebrations as virtual gatherings. If you do host or attend a gathering, ideally you'll be able to limit the size of the people who you're gathering with. To the greatest extent possible, wear masks, even if you're indoors together. I know some of the advice that CDC and other organizations down south are sharing is to try to hold your Thanksgiving dinner outside. And that's probably not a very reasonable or realistic suggestion for Alaska. And even to just, if you're going to be inside, leave all your windows open. That's probably not realistic either. But so that's social distancing, staying 6 feet apart and wearing a mask while you're together, limiting the number of people working with the food and coming into the kitchen. Don't set up the food buffet style. Well, that might be the way you normally do it, or put it all out family style on the table and share it. If you could identify one person who's well masked and sanitized, maybe to plate everybody's food for them, would be the safest way to host that dinner and to share food with each other. So those are just some suggestions. I wanted to mention, this is something that's a real challenge, and Tom, and I have to confess, Tom and I don't think have made a final decision yet because our two children and one significant other, the three of our kids were living with us until just this past month, and got their own places in Anchorage recently and moved out. And we've been very much looking forward to having them back home again for Thanksgiving. But we're having a real serious conversation with them right now about whether that really is the safest thing to do. And Dr. Bernstein, our chief medical officer, came into my office and was reflecting on some of our top leaders who've canceled their trips just in the past few days to visit family. And he shared that he wished that people understood that as difficult as it might be to not be able to share this one Thanksgiving with your friends and family, that some of these gatherings that are going to happen will result in increased deaths. And putting off this one holiday and this one celebration together could mean being able to celebrate with your friends and family for many, many years to come, and to have many more celebrations afterwards. So I think he would implore, and I will echo, just thinking a little bit forward that way about the implications of gathering right now. So I have been talking nonstop for a long time. I'm going to take a break and turn it over the microphone here over to Regina, who's going to spend a little time talking about what we can do if we're sick and exposed.
Hi all. So this is something I deal with on a daily basis, with questions for the Muni and making phone calls and such. So the first question that we have is, well, Deb did a great job of covering pretty much all the symptoms. But if people are sick or if they're exposed, so if someone calls and says, hey, I'm sorry, I'm positive and I accidentally exposed you. So if that happens, the key thing is that you would be, if they're a positive case, then you would quarantine for 14 days. We'll get more into what quarantining and isolating means in a minute. But you would quarantine for 14 days. And during that time, if you started to get symptoms, or if you just were like, I have something really important happening the week after those 14 days, I need to go get tested kind of thing. If you test too early, so say you were exposed today. Well, if you go and you get tested before Thursday, there's a 67% chance that you may be positive, but come back with a false negative. And the reason for that is that the virus has to build up in your system. As Deb was talking about, the virus can't build on its own. It has to capture a cell essentially and get the cell to replicate for it. And so what happens in that case is the body doesn't have enough of the virus to tip that scale to say, yes, you're positive or you're negative. So you can get a false negative. In quarantining, they're going to ask you to monitor yourself. And if you start to have symptoms, they're going to tell you if you start to have difficulty breathing, or if you start to have like chest pain, or like just super chest tightness and you feel like you can't take a nice deep breath. All of those would be something that we would encourage you to immediately go get tested and call your healthcare provider or seek medical attention immediately. But let them know that you were exposed before you show up. I've had lots of people this summer and in the last few months that I've called Providence and said, hey, this is a potential positive. We know that they were exposed, 9 days ago, and now they're having these symptoms and they're coming to you via ambulance, or their family members driving them over, kind of thing. And we always give them that heads up so that they can be in full PPE and ready to take them, and not let them sit in, the waiting room with symptoms that may or may not be COVID, kind of thing. But if they were exposed, we always try to give them that heads up, like, yes, this is happening. But if you have persistent pain or pressure in your chest, call right away. Any new confusion? I haven't had a whole lot of this with people, but I have had a few people that have had where they just can't like remember something all of a sudden, and they just seem really confused. And like when we say, okay, do you have someone who can give you a ride to the ER? And they tell you, I don't know where my phone is, but yet they're talking to you on their phone. That's concerning. So just things like that. And monitoring yourself for symptoms would be like the cough, the shortness of breath, the fatigue, the extreme fatigue, fever, chills, let's see, any nausea, vomiting, diarrhea, and like muscle aches and pains. And the big thing that a lot of people kind of shrug off as not a big symptom, but it's very evident of COVID, is the loss or change in taste and smell. That's when a lot of people are like, well, I didn't think much of it, but then I can't taste anything for 2 weeks. And it's like, oh, that's a problem. So let's see. And then, so we'll talk about the quarantining. So if you were exposed and you wanted to get tested, we say day 7 to day 10 of your 14 is usually the best time, because then you're not likely to get a false negative, but you're more likely to, if you're having those symptoms, like Deb said, that most people start showing the symptoms between day 2 and day 10. So if you get tested around day 7 to day 10, you're more likely to show if you're positive. Even if you're on the earlier side of being positive, you would show up more often then. Now, let's see. And then for the quarantine versus isolating. So if you're isolating, you are a positive case. You've been called usually by the Muni or state epidemiology, or just wherever you got tested, even, because right now our numbers are so kind of chaotic and high right now that some people aren't being called at all. If you're a healthcare worker, you're being called, dependent on your age. If you're a high risk person, you're being called. But if you got tested at one of the drive-through clinics, you may literally just get the email that says you're positive, and this is how you quarantine and isolate. Right now, the health department is so overwhelmed with contact tracing that we are asking positive cases to contact all of their people that they've been around. But we'll get into that a little later. And so if that's the case, you start monitoring yourself. Okay, we'll take me for example. If I'm positive, I need to isolate from my family because there's 3 others still in my house. So there's Andrew, Sam, and Isabel. So quarantining means we're all at home. We're not going anywhere outside of our home. We're not around other people. People aren't coming into our home. Isolating means that you are staying away from even the people in your home. So in isolating, we ask that you not cook or not handle food for other people unless you're masked and not gloved up, but at least wash your hands thoroughly and are masked. And that way you're not able to breathe on their food. Like in my case, thankfully I don't cook. So Andrew would be the one cooking. If Andrew got it, we're all in trouble. So staying home, if you're isolating, it's 10 days. So it's 10 days either from your first symptom or from your positive test date. So, but if you're quarantining, it's the 14 days, and it's because you can start showing symptoms on day 9, day 10 after you were exposed. So that's why we have you quarantine those extra few days, just to make sure you don't become positive too. In the isolating, it's that we want you not sharing rooms. Like if one kid had it, we wouldn't want them to be playing Legos or whatever in the same room with each other. Wearing a mask when you're in shared spaces. So if I was the positive case, I would wear a mask when I came upstairs to fix myself lunch, and then take it back downstairs and go isolate in my room away from everyone. Splitting bathrooms, that's a big one, because you don't think about how many surfaces in your bathroom you may touch. And if you're going to the bathroom at 3 in the afternoon and you're running in real quick and running out real quick, and you're touching surfaces and stuff, even though you're washing your hands, you don't go back and wipe down everything every time with like Clorox wipes or whatever to kill the virus. So if you're sharing facilities, that's an important one, that if you can split and not share facilities is a big one that we try to get people to do. On the positive case for isolating, they would be cleared on day 10, so they could run out and get groceries for the rest of the family, but the others still would not be able to. So if I was the positive case and I hit my day 10, now it's day 11, I can go to the grocery store and get what we need, but Andrew still can't. And the kids are still stuck at home. They're not able to go play with the neighbors. Let's see. Okay. So if I'm the positive case, Andrew and the kids' quarantine starts on the day that I started isolating. So if I got tested on a Tuesday, but I didn't find out my result till Thursday to know to stay away from them, their isolation date, their quarantine date wouldn't start until the day I was able to isolate effectively from them. If you're not able to isolate effectively, like if we lived in a smaller home or we didn't have 2 bathrooms or something, they would technically be in quarantine up to 24 days. And it's because I wouldn't be able to split away from them. So every day that I'm around them during my 10 days, I could re-expose them. So even though they wouldn't need to be going places either, because they should start their quarantine, but it is possible for me to share my germs with them on like day 8. Well, they couldn't go back to that Tuesday and say that they started quarantining that day, because if I expose them a week later, then now they are out exposing people too. It's kind of a hard one, but especially in families where you have multiple people that turn positive at different times. I had one family that was a family of 6, and they stayed either on isolation or quarantine, someone in the family, for the entire 3.5 months of summer. From May, when the dad was positive, until the wife finally got released in the first week of September. But between their 4 kids, every week somebody was either turning positive or having symptoms. One of the kids was under 6 months of age, so the pediatrician didn't want to test, which totally makes sense. But until that kiddo hit her 10 days, and then we restarted everybody's 14 days over. And the wife was kind of bummed. She kind of was like, because eventually all the kids ended up with it, she kind of wished that they had all gotten it at the same time and been done. Because she had 4 under the age of 6. And so she just wished she could have taken them to the park and that kind of thing. But for nearly 3 months, they literally played in their backyard, and she measured it for me one day, and it was like 32 feet by 12 feet across. So she was like, this is not going to work. But finally they did get to go to the park. She sent us pictures. It was great fun. But it was September. So it's difficult, but if people can quarantine within their home and wear a mask, and like at our house, there's been multiple times where I've been exposed because I tested people all summer. So we know I was exposed multiple times. So I just try to not be around our kids as much as possible, just in case. Now I've been tested during the summer, I was tested pretty much weekly. And then now I get tested every month, every 3 weeks for the health department. So on that, we just know that, this is kind of our game plan. This is what will happen. This is what we have to do if it comes down to it, kind of thing. And just kind of realizing what the capability of your family, like if Isabel wanted to read a book to me, I would have to be in a mask and more than 6 feet away from her if I'm positive. Or be in if we could go outside this time of the year, you're not really going to go outside to read a book. It's a little cold for that. But at least you wouldn't get the nice effect of lounging on the couch and reading a book like normal. Wouldn't be quite as fun. But let's see. Yeah, so it's kind of a case by case of how it changes, but the family could be in quarantine for weeks on end, because if multiple positives happen, it is very likely that they'll stay in quarantine much longer than the 14 days, unfortunately. Okay, that is all of mine for right now, Deb.
Great. Thank you so much, Regina. And if you all have additional questions about anything we're covering, if you just make a mental note, we'll try to leave a little bit of time at the end to answer your questions. But it's possible we'll be getting to a question that's going to cover what you're thinking about next. So bear with us for a little bit longer. The next two questions I have to cover are related to hospital issues. And the first question the committee asked me to address was, how much reserve hospital capacity do we still have in Alaska? What are the risks that we run out of capacity, and then what? This is something that's a little bit hard to answer, and maybe it's because I don't want to think about the answer. A hospital is pretty comfortable operating at about an 85% capacity level, with about 85% full. PAMC this summer, for a good part of the summer, at least the last couple of months, has been running at about 90 to 95% full, for our adult beds anyway. And so it's pretty stressed. Our capacity is a little bit more freed up right now, just because it's typical for people to avoid having procedures and surgeries done the week before Thanksgiving. But two things have continued to happen at once. So the COVID positive census in our hospital and the hospitals across the state have been rising steadily. We hit our high this past week with 48 COVID positive patients in PAMC. This morning, we had 9 patients in our ICU, and many of them on ventilators. We pretty much have taken over our, initially started off the summer with just 1 of 4 hallways of our medical surgical unit devoted to COVID positive patients. And that unit is pretty much filling up at this point. I think we have 2 completely full hallways and another hallway mostly full. And we have other levels of care within the hospital. Our intermediate care unit is completely full with COVID positive patients right now. And I am really concerned at the case counts the past week. Last weekend, the one day we had 700 and then 600. I can't remember. All of those. All I could think of was 10 days from then, which is probably going to be around Thanksgiving. What percentage of those folks are going to end up in our hospitals? And it usually does take like 10 days to 2 weeks before the disease progresses in the way for those folks who are going to get very, very ill and need to be hospitalized to reach that point where they're going to end up in a hospital. So they might go through the first week and start feeling okay, and then all of a sudden just completely decompensate. So I've listened to the stories of what's happening now particularly in the Midwest, and just a week or so remembered hearing the medical director in one of those hospitals on the radio saying, at one point it felt to him like somebody had just opened up a spigot and patients were just overnight flooding into the hospital. I kind of felt like that one day when I came into the office one morning and we'd had 10 new patients come in overnight, COVID positive patients into the hospital. And that can be pretty shocking and disturbing to see. But the thing that I don't think I fully appreciated or understood was that, while the spigot is kind of feels like it's slowly opening up for us, I feel like somebody's opened up a drain and all our staff are floating away. Because you know, our staff are all part of the community. And as this virus, as this pandemic grows in the community, it's mirrored in our caregiver population. We hit a new high of our caregivers at PAMC out due to either having symptoms, actually being infected, or having to quarantine for exposure. On Thursday, we had 137 staff out for COVID. And that's not counting the folks who are out for other reasons. So that really is my biggest concern right now. We have plenty of space. We spent the summer identifying other spaces where we could put beds, developing doing all of the remodeling work that needed to be done to make sure we could keep people in the appropriate isolation and precautions with negative pressure. We have the entire Alaska Airlines Center that the 3 hospitals and the state and muni partnered on transitioning to be and remodeling to be an alternate care site, so it could serve as kind of a 4th hospital for the community if we get to the point of needing it. We have plenty of space, we have plenty of beds, but I am really concerned about having enough staff to take care of people at this point. There are lots of things we're doing to adapt. I think one of the things that's just breaking my heart, but it's understandable. ICU nurses are in such demand across the country, and that's the other concern. If this was just Alaska, we could call the cavalry. People would come from across the country to come help us. But it's everywhere now. There's no cavalry that's going to come to help us. And ICU nurses are in such high demand. We actually just lost one. I'm afraid we might lose another to a traveling nurse agency. Traveling nurse agencies are starting to hire ICU nurses with salaries of the equivalent of over $300,000 a year. Oh. So that's kind of our situation right now, but we, like I said, we have a whole bunch of strategies we're working on. We're cross-training nurses. We're taking nurses trained to operate at a little bit lower level with patients with simpler care needs, training them up, putting together new models of patient care that bring in different configurations of nurses. So where the gold standard might be to have one ICU nurse for one ICU patient. And if there's anybody with looking at Denny, with the nursing union, just close your ears. But we are looking at ways where we can support the ICU nurses to provide more care to more patients by bringing in other nurses with other training and training them to support that nurse. Simplify that as much as possible. We also actually too regularly right now, and this worries me, have nurse managers working on the floor, filling in for vacancies when their nurses are out sick. And I got to tell you, folks are really getting pretty exhausted at this point. And, you know, I read the article in the paper. Some of you might have seen Dr. Wesley is one of our infectious disease doctors, and he talked about the healthcare workers being terrified. And I really, in one of our surge committee meetings, was particularly concerned a couple weeks ago when I really could start hearing fear in our doctors' voices. I don't know that I've heard fear in any of our nurses' voices. They're just tired. They're just exhausted. I didn't mean to go on so much about this, but I guess I'm more worried than I was trying to let on, and that I allow myself to let on when I'm at the hospital. We're doing everything we can and we'll continue to provide good quality care. There are other hospitals. I know one of the other hospitals in Anchorage right now actually is working on postponing all of their elective surgeries for over the next couple of weeks and pushing those 30 days out. At PAMC, we have no plans to do that right now. that is an alternative if we get to the point where we just can't bring any more patients into the hospital, if it can be avoided. But right now we are fully committed to providing a full array of services that we provide now, and are just going to keep doing everything we can, but really need the community's help and support in doing everything they can to slow down the spread of this disease. So the one other question I have about hospitals is why we can't visit loved ones at the hospital right now if we take appropriate precautions. And that has been such a difficult issue from the beginning of this pandemic. Especially, and I was so new to working in hospitals, I had to keep asking people to explain to me why we had to do that, because I could see in some of the bigger cities around the country that there were hospitals that were allowing at least one visitor in for their patients. And finally somebody had to sit me down and say, we don't have, essentially what I was explaining just now. There was an outbreak among ICU staff at Virginia Mason a couple months ago. 4 caregivers were infected, and they were able to trace in their investigation that infection back to an infected visitor for one of their patients. And you know, as much as everybody promises to and tries to follow the appropriate precautions, it can be really hard to do. Well, and it's particularly hard for the staff on the unit to make sure, while they're trying to take care of the patients, to make sure the visitors are wearing proper and observing proper precautions. And we can't afford that sort of loss, as I was just describing here. We don't want to risk our patients or our staff right now. We don't have another hall across the way or across the town that we could send our patients to if we were to have to close down part of our one of our units. So that's why right now we have such strict restrictions against visitation in the hospital. Children in the hospital are allowed to have their parents as visitors, and people at end of life. We have set up opportunities for them to be visited in person. But other than that, we do everything we can to support virtual visits with iPads. And every hospital in Anchorage right now is, and pretty much from the beginning, has been imposing those same restrictions. So those were the hospital issues I was asked to address. Regina has a couple more community issues.
So one of the questions that came up was, how does contact tracing work and why is it important? It's kind of actually changed in the last month. Our numbers have grown so much that the Anchorage Health Department and state of Alaska, we've kind of what Deb was talking about, where we've trained people up. We've taken people from all sorts of positions at the health department and train them to do contact tracing. And now we can't even maintain that because our numbers are too high. So now we're having to kind of outsource. We have nurses all over the state. The state of Alaska was pretty awesome that we could set up what's called ComCare, which is a shared electronic health record, essentially. But they can assign us cases from the state of Alaska, can assign cases, positive cases, to a nurse that's anywhere in the state to give calls. So like this week, I've only been calling people in Anchorage just because our numbers are so high. But back like the end of September, the beginning of October, because our numbers weren't terribly high, but then that was when like Kenai and YK started having increase in numbers, and they only have a couple of public health nurses. So then Anchorage Health Department was able to help and make some of those calls and notify people. At that point, we were still doing contact tracing. We don't have the capacity to do that. So now if we call and we say, hey, you're a positive case, please call anyone you've contacted that you've been into contact with in the last 2 weeks or in the last week, and let them know that you're a positive case and to monitor themselves and that they need to be quarantined And we'll give you dates, like kind of what we were talking about earlier, where it's you go back to your test date plus the 2 days before it if you're asymptomatic, or the 2 days before you started having symptoms, because those are the most likely dates that you were able to spread it. At this point, there are people that are positive cases that are getting a letter in the mail, because if they are not healthcare workers and like they're in their 20s and 30s, we've had a lot of people in their 20s and 30s that are still going to bars and restaurants, still doing group gatherings, people we presume are healthy people. We don't necessarily know that 100%, because a lot of times you're not being tested at their doctor's office. They're being tested at the drive-through clinics. The drive-through clinics have like, I don't know if anybody on here has been to one, but it has like a brief little questionnaire that basically asks if you're symptomatic or not. Hold on just a second. Sam, can you wait until I'm done? It's like 10 more minutes. Thank you. Sorry, Sam's trying to make lunch, growing boy. So we have right now, contact tracing has been kind of delegated to the positive case. Now, if they are a healthcare worker or they were at work and they may have exposed multiple people at work, we're more than happy to call and contact businesses and say like, hey, you may have had a positive case on this day. We still don't give the name of the person unless they consent to it. Like some people are like, oh, I've already called my boss, here's a cell phone number kind of thing. And in that case, we'll call and say, how many people was this person possibly around, kind of thing. It's always interesting because some people will say I wasn't around anyone. I know we had a lot of people on base a few months ago that were, because the J-Bear has their own public health nurse staff. And so they were contact tracing. And then we would have people call the health department and say, hey, I'm a positive case, but I belong to base and I wasn't going to tell them, but I went to this bar, this restaurant, and I hung out with these 12 people. But their commanding officer reprimands them if they tell the public health nurse on base. So, which is part of why they're back on, was it HCON or whatever it is? I'm not a base person. I don't know exactly what it is, but basically the base is back on lockdown. They're not allowed to go into a restaurant and even pick up food. It's, if they can do the contactless pickup from their car, they're allowed to order. But my understanding from friends that work on base is they're not allowed to eat out at all. No matter what the limitation is by the city, it's absolutely not. You're essential staff. It's not an option for you kind of thing. But we did have for several weeks where people weren't being 100% honest with us, which I think is part of why our numbers have gotten out of control at this point, is because we weren't able to contact and tell people that they were exposed, or they exposed their commanding officer and they weren't willing to tell them that, which is also an issue. So we did have some that were cases like that. We have had lots of people that don't want to tell us the name of where they work because they're afraid they'll get in trouble kind of thing. So there's only so much we can do about that. In your personal logs, so I would say at this point, most of us on here are probably not going too many places anyway, but just kind of keeping like mental note. I write like a sticky note, like I went to the grocery store on this day. Like obviously at the grocery store, unless I run into someone I know, I'm not standing and talking to anybody for more than just a few seconds anyway. But, if I ran into like an old teacher friend or, we talked for 10 minutes at the grocery store, I'm wearing my mask the whole time, but I just kind of write them down like, oh yeah, I saw so-and-so this day kind of thing. When we call and do that, now it's that we're asking you to do your own contact tracing essentially. And so, a lot of us can look back at like text or our calendar. If we had some big event that we did, we would be able to see that. But, I went and I took food to Deb's house, or, you may not remember, the little like, oh, I dropped something off, but I did stand outside and talk to them for 15 minutes kind of thing. I had friends this week that dropped food off to me because I'm in quarantine. So it's like they did it at the door, sent a text, we never were in contact kind of thing. But they did write down that they dropped food off to, just kind of as a personal side note that they did drop off food to us, just in case. So just kind of keeping tabs, and with Thanksgiving and Christmas coming up, just know who's been in your home, who, because if they turn up positive, you want to be able to say, okay, well, they were in our house on Sunday and we need to clean here, and here, like, kind of thing. Just to keep your transmission, your rate of transmission down, and what you can prepare like in your home. And really the safest you can be is not be around people, but I mean, it is family time of the year. That's, you know, we all visit and kind of thing this time of the year. So just keeping your personal log of, you know, so-and-so came over for 20 minutes, wore mask whole time. Just little notes just to help jog your memory if need be. Oh, okay. The decision to open schools. So that's changed quite a bit. If you read the newspaper in the last 2 months, we had a plan in July that went out and was a formal plan that my understanding was kind of looked at by a lot of docs in town, and was kind of, I think Dr. McLaughlin and Dr. Zink and Dr. Olson and Dr. Chandler all looked at it. And yes, this is a good plan. And then in mid-September, Dr. Bishop decided she wasn't going to go by that. She was going to choose when kids went back and which kids went back, and we weren't going to follow those protocols. And then with the mayor change happening, and thankfully right now we're not in school, because the reality is that there should have been half capacity at elementary schools starting this past Monday, technically. But at this point, we're all seeing cases in the lower 48, especially, of where they're shutting down complete school systems. I know in Matsu, they were just in the paper this week that through Christmas break, I think is the plan now, that they're going to be online, and they were handing out laptops and stuff this week. So at this point, there were some CDC guidelines that said if appropriate mask wearing could happen, and was going to be like non-negotiable, like it had to happen, where everybody wore a mask. Contact tracing is happening. At this point, the city can't contact trace. Well, I am the only medical person in my school. I'm the only nurse in my school, and I have 1,900 kids and staff. So if we had 40 something exposed, I can't even call all those people in a work day, much less the tube feedings, the testing, and all the other stuff I would actually be doing at school in a work day. So I don't know. I know right now the school board is looking at if we stay online through the rest. High school and middle school are not going back until at least January. I know that. Now the school board is looking at that we need to know the numbers of the what the hospital capacities are, because as soon as schools open, we will start having more cases. Maybe not in the little guys, maybe not in the kids, but the kids being exposed at school to other kids. Kids are often asymptomatic, and if they bring it home to a family member or a grandparent that watches them after school, those people could potentially end up in the hospital. So we've got to keep a look on those kind of things. So the 5 CDC guidelines were the contact tracing, hold on, I actually pulled it up because I always miss one. It is social distancing to the most extent possible, hand hygiene and respiratory etiquette. So they're like wearing the mask all the time. When you do sneeze, you sneeze in your arm, coughing into your elbow, and washing hands immediately after. The cleaning and disinfection, contact tracing, and the consistent and correct use of mask wearing. So people are people, little guys are little guys. Not everybody's going to be able to wear a mask for full 8 hours. So we did decrease the school day to, I believe right now we're looking at like 5.5 hours. High school and middle school will not eat in school buildings at all. The plan is that they'll get out a little early, and that we have like bagged lunches for them to take out the door, and they eat when they get home. High school is used to being at school at 7 a.m. like classes start by 7:30. It's going to be very interesting because normally high schoolers at my school eat at 10:20 in the morning. So if we're telling them you're not getting to eat until 1 or 1:30 when you get home, even, there's going to be sneaking food. There's going to be moving of mat. There's going to be some of that. And, we're kind of, every school has created a plan. I looked on Friday, and I believe every school's was updated. Some of them are up to 40 pages long. But it literally goes into when kids change classes, and it'll have like this class is going from this classroom. It has like a full cycle of what your school day will look like. I know a lot of teachers have created like barriers and stuff in the classroom. Like right now I'm sitting like 1.5 feet away from my son at the kitchen table. And we both have our computers on, but a lot of teachers have created like like a vinyl barrier that goes in between. But the reality is people shouldn't be facing each other. They should always be wearing a mask and social distancing, because if you call the muni and you say, oh, well, Sam went to school, but his closest buddy, everybody was wearing a mask, but they were 3 feet apart. It's not going to matter to me that there was a piece of visqueen or vinyl in between. That kid's still close contact, and the whole class is going to be in quarantine. And that's just the reality of it. I think right now we're kind of more looking at whether or not we should be going back to school. I know there are some people that are totally for it, some that are against it. Right now, the district is looking at doing like the small cohort groups that we can control and maintain, that you would sign like a waiver that says that, you're bringing your kids to school to be in this session, but we expect you to follow the recommendations of the CDC and of the health department, and that you keep your bubble small so that your kid can maintain staying in this school bubble kind of thing. At this point, if numbers stay up, I'm not super confident we'll get to go back to school, at least not school. School as we know it will not be normal this year. Whether we stay online, we're not really sure yet. But in a lot of places, we have created like the new cleaning protocols, and I know every teacher has like there's a cleaner that we're creating every 3 days, and I'm so gonna mess up the name of it. It's one that we make in our bodies. It's hydro something, but and teachers will get a new one. Like they'll take the bottle and refill it, like remix it every 3 days so that it stays effective. And my school created a plan. It took us like 35 minutes to figure out the plan as to what classrooms will be reissued at which days to make sure everybody gets it every 3 days. That is super contingent also on the BPO. If your BPO becomes ill, does that throw off our schedule of what and who and when and where things come from? So at this point for school, we're doing our best. We're trying. School may end up going online and then going in person and then being online for 2 weeks, or kind of back and forth, unfortunately. They're trying to mitigate plans to do that right now. The hardest thing is that if our numbers keep going up, is it safe to open schools? Unfortunately, probably not. And that's something that I feel like the city as a whole needs to be aware of. Lots of people are pushing for school to open, but lots of people aren't pushing to not eat out or, to do the things that need to happen for schools to open. But they are, in the beginning, the school board wasn't really concerned with the bed numbers, and a lot of nurses pushed back. I was one of them, that pushed back and said, the beds aren't the problem. It's the nurses. It's if you don't have staff for those beds, just like we have all the schools in the world, we've got all the space we could need in a school. If you don't have staff to teach kids, the school can't be open. Connie, I just saw your question. There are contact tracers. UAA has a program where anybody can be trained to be a contact tracer. It's about a 32-hour training class. You get a little certificate. I believe they're still doing it. And I think if you search UAA contact tracing, I believe it's sent, you can get the link and you can send, it has like the contact person, their point of contact, gets confusing. Their point of contact for the program will email you back and tell you, yes, we need people, and kind of give you dates. I know we just recruited a bunch of National Guardsmen to be contact tracers and to help do daily monitoring, because if people are high risk groups, we have a lot of assisted living homes right now that have positive staff or positive patients in them. So I know even as a muni nurse, there's been days where I've had called assisted living homes and they've literally asked me, you're a nurse, you can come work for us. We don't have nurses. Do you want to come to work this weekend? No, thank you. I'm good. Yeah. I'm just reading Vivian's chat comment too. It's going to be interesting. I don't know if we'll get offline this year, unfortunately.
So Deb, we're running out of time. Should I try and talk a little bit about vaccines and something, and then before we're all done? So let me talk just a little bit about what I know about asymptomatic spread, going back just a minute or two about what Deb was talking about. Just this week, Nature published a meta-analysis about asymptomatic disease. And as Deb said at the beginning, there's so much we don't know about this virus. And this is going to be lots of research over the next 5 to 10 years. But the current estimate is that 20% of people never get symptoms. Nobody knows why. Is it because you have partial immunity from previous coronaviruses you had before? Is it because the person that infected you didn't infect you with a big dose and your body was able to handle it? I think that's a hypothesis many people have, which is, again, one of the reasons for masks, is even if you do spread, you spread less. Another thing about hospitals that has changed a lot from New York to now is that you don't hear as much about people being on ventilators. And so the care of people that are really hospital sick has changed. You probably have heard that people are put prone. It's not a common hospital position to have people be on their bellies because it's lots harder for staff to take care of them and for the person to stay. But it's pretty clear that people's lungs do better if they're kept prone a lot. Dexamethasone wasn't known. It's a common steroid. Wasn't known last spring how much of a difference it would make. And there will be more therapeutics. I mean, this week I just read that remdesivir, that a lot of publicity about, has been judged to probably not be effective for most people. So there's lots to come on the therapeutic side. But the good news is more people are living even with a hospital experience. But the current information I read is if you get hospitalized, about 1 out of 6 die. So being hospitalized is, you're really sick. So let's talk about the good news about vaccines. So one of the really good things our country did, we did lots of things wrong, but this Operation Warp Speed is one of the things our country did well. And it really is a good example about science and government can work together. And what the NIH and Dr. Fauci's Institute and CDC did, and the FDA, was they picked 6 different ways that vaccines are made. And they picked 2 companies that wanted to work in each of those 6 areas. So our country invested, they picked the winners in each of those kind of methodologies, and then negotiated contracts to put a lot of money into those companies, both on the research side and then on scaling up the manufacturing faster. The first 2 that are going to come to market, I think, with certainty sometime during December, are Pfizer and Moderna's vaccines. And these are a whole new class of vaccines we've never had before. They're made using messenger RNA and against the spikes that Deb talked about. And it's really, the technology is amazing to me to read about, with a speed with which the companies have developed, understanding the DNA. One of the things China did well is they published the genome of the virus back before the end of January. And Moderna, for example, had figured out which gene they were going to make antibodies against, and had developed that within 1 week. It's really pretty amazing. So those 2 vaccines are coming to market, as you've read. They're amazingly effective, it appears. They're also very safe, it appears. And the first vaccines, well, I think, will be being shipped out before December is done. As Deb said, and if you go to our State Department of Health and Human Services website, they just put up the first population to be vaccinated. Not surprising, our essential workers and hospital workers are going to be first. Then it'll be the other essential workers. I would assume that people that have pre-existing conditions will be in the higher risk. They'll get them in the spring probably. If we're healthy and not an elder, you're probably kind of going to be in the lower priority. What happens to Ruth and me that are technically elders but are healthy? What category will we be in? I don't think any of us know. I think many of us wish that a lot of that was published on the websites soon already. I fully expect that before the end of January, the prioritization populations will be published, and the states are already working with CDC on how they're going to deploy. As you've read, these first 2 vaccines are going to be tough to deploy in our state. Pfizer's being the most difficult because it has to be kept the coldest, minus 70 degrees centigrade. That's really tough to manage a logistics supply chain out to villages. Moderna's isn't quite as difficult. It has to be frozen, but an ordinary freezer works for Moderna's. Both of these are also complicated. You're going to need 2 shots. So how do we manage the logistics of keeping track of which one you got? What happens if people lose their card? Making sure that there's computer technology with deployment. This is going to be a huge logistics effort. I am encouraged that the country as a part of national policy is going to use the military as part of the deployment workforce, because we're going to need a lot of people to vaccinate all of America. Lots of people have asked me, Dick, are you going to get vaccinated? And my answer is the minute that I'm able to get vaccinated, I'm going to put myself in the queue. I think the science is good. I think the review committees, both inside FDA, the independent review committees, I do trust the scientists, and I don't think the politics are going to affect the safety information. Now, there's a big population that hasn't been tested yet. Kids. I'm a pediatrician by background, I said. So kids, when you're doing studies, there's a whole bunch of extra precautions because the kid can't give informed consent. Their parents are giving in their behalf. Pfizer just 2 weeks ago started adding teenagers to their population and is now testing in teenagers down to age 12. Nobody has yet published how they're going to do younger kids yet. Also, pregnant women haven't been tested, haven't been in the study so far. The good news is, and one of the reasons Moderna is a little bit behind Pfizer is there's FDA said, you got to slow down and stop. We aren't going to approve your vaccine until you get more people of color and more gender diversity into your population. Pfizer did a really good job in finding populations of color, vulnerability, and so on. So Moderna got slowed up for 2 to 4 weeks while they added to their population in their study group. And they now have a really robust, diverse population in their study group. You may have heard of AstraZeneca. This is the study or the vaccine being developed out of England. That's being tested in multiple countries. And my understanding is they also have a good, diverse study population. So when are we going to get vaccinated? I would guess, I heard Dr. Fauci last week saying, it's going to be third quarter probably for most of us. Some of us on this call are going to be in higher risk populations, and we probably will get vaccinated in the second quarter. I would guess by the time we get to the end of the third quarter that a lot of Americans have had the opportunity to get vaccinated. How much vaccine resistance are we going to have? I'm a pediatrician. One of the sad things has been the growing vaccine resistance in America. And initial Gallup studies have indicated a lot of Americans think this whole thing has been politicized and are really concerned about getting vaccinated. I'm really hopeful now as the approval process goes on, and as those of us on this call, those of us, our friends who get vaccinated, that we'll have word of mouth sharing about our confidence about safety as you reach that point. I encourage you to watch the literature. As Deb reminded or showed me last night, the Department of Health and Human Services is now posting a vaccine website. You can get a lot of information there. They really have a good table on it of the different kinds of vaccines as these different vaccines come to market. What are we going to have available in Alaska by, let's say, next summer? My attitude at the moment is if they're all 90 to 95% effective, I don't care which one I get. But if one is 70% effective and one is 95% effective, I might care some more, but then I'll trade that off. How long am I going to have to wait? Because Ruth and I want to go see our grandkids. And so, we're going to want to travel next year, and I'm praying that we'll be able to. And so I suspect we will probably line up as soon as we can get a vaccine, would be my guess. Deb, I think with that, I will stop.
I think that's good. And we are a little bit over time. We were planning on going to about noon, but I hope, so I am not, well, I made the offer a couple of times, going to, I think, take any more questions at this point. Hopefully we touched on most of the topics that you were interested in, but both Regina and Dick had mentioned a couple of times that you could go to the Muni Health Department or the State Health Department website. With a simple Google, you could find those addresses, and they have lots of good information there. CDC also has really good and pretty simple to understand information that you could go and don't hesitate to reach out over email if you have some burning questions that we didn't get to that you have for us. I am not going to do, even though it was kind of short, a full devotion since it's gotten late, but I have a short prayer I thought I would end with, if that's okay. That's from, yes, Regina.
Yep. I will say this, that the school district is already looking at ways to, if anybody got a flu shot through ASD and the Muni, the joint things that we've done this like in September and October, I do know that the school district is planning on utilizing school nurses and our school-based hubs of when we get the vaccine, that we're all planning on getting training and how to store and all that kind of stuff too. So it'll be out there. I don't believe that you'll know about it. Trust me.
Well, for sure. Well, so thank you all very much for sticking with us. It was a ton of information that we just downloaded. I hope you found it helpful. And so I'll go ahead and close with this short prayer. Let us pray. God of silence and stillness, we trust you are with us in this time of noise and chaos. We pray for an end to this pandemic. Whisper your words of comfort, encouragement, and hope to all who need them in these days of fear. Draw close to those who are sick and all those who risk illness caring for them. Protect and uplift them. In your name we pray. Amen.
Amen.
Thank you all.
I recorded this, and if I can figure out how to get it to Amanda, she can help me, then we can link it to the church website if you want to go back and listen to any of it. So this will be something new, but I assume Amanda will be able to help me figure out how to get it from a recording over to the church. So with that, thanks everybody.
Thank you. Bye.
So Dick, if you hit stop recording.
Cecilia, one of each, please.